Are you tired of stumbling across misinformation about your thyroid? I get it. I'm going to give you the top 4 symptoms that something might be going on with your thyroid and what to do to heal it. So many of my patients come into me on thyroid medication. I'm going to share with you what they wish they knew before they jumped on these meds. But before I get into that, I got to give you a short lesson on thyroid physiology. Your hormones start in your brain. There's 2 main glands called the hypothalamus and the pituitary. These are your master endocrine glands. They basically control your thyroid, your adrenals, and your reproductive organs, your ovaries or your testes. Now, I used to think of those glands, right? Your thyroid, your ovaries, and your adrenals, kind of like a 3-legged stool. But I come to realize that I was wrong about all that, because as goes the adrenals, so too goes the other 2. And I'll try to explain why. So what happens is the hypothalamus, to create thyroid hormones, the hypothalamus tells the pituitary to tell the thyroid to release thyroid hormone. Well, and it works the same way with the HPA axis. Hypothalamus tells the pituitary to tell the adrenals to release your stress hormones, your cortisol. Well, as it turns out, that cortisol, when it's released, goes everywhere in the body. There's all cells in the body have receptors for cortisol, but it also goes back to the hypothalamic pituitary thyroid hormone axis and suppresses it at every level it possibly can. It tells the hypothalamus not to trigger the pituitary, to not tell the thyroid to release hormone. It tells the thyroid to actually release an inactive form of thyroid hormone, even called reverse T3, which you may have heard about. Just in case it missed suppressing the thyroid gland anywhere else, it causes it to release this inactive form of thyroid hormone, then goes around to the cells, binds up receptors, and suppresses it even more. The number 1 cause of hypothyroidism in North America is a problem with your adrenals and your stress hormones, primarily cortisol. Now, what cortisol also does when cortisol is released is it messes up your immune system. So that cortisol goes to the immune system and causes it to shift, and that immune system shift causes a suppression on one side and kind of an excitation or overactivity on the other side. It's that overactivity side that's important. The overactivity means the immune system creates too many antibodies to things. This is actually the crux of where allergies come from, whether it's environmental allergies or food allergies, but even allergy to your body's own tissue, which we call autoimmune disease. Now, depending on where or what organ the immune system attacks, we give it different names. If it attacks the joints, we call it rheumatoid arthritis. If it attacks the salivary glands, we call it Sjogren's disease. If it attacks your spine, we call it ankylosing spondylitis. If it attacks your thyroid, we call it Hashimoto's thyroiditis. Hashimoto's thyroiditis is an immune system suppression of thyroid gland function, which is the most common cause of hypothyroidism in this country. I have never had a patient diagnosed with Hashimoto's come into me who did not have an underlying adrenal problem causing it. So those top 4 symptoms, right, that we associate with thyroid, whether it's weight, fatigue, depression, constipation, just overall sluggishness, right? Those symptoms, yes, they could be coming from your thyroid, but they're quite likely it's an underlying problem where your adrenals are suppressing your thyroid. It is virtually impossible to fully get control of your thyroid, no matter what medications you're on, whether it's synthetic thyroid hormone or more natural thyroid hormone. It's almost impossible to stabilize and support your thyroid well enough if you're fighting through the storm of stress physiology, cortisol, and adrenal fatigue. Now, just so you get the newest information that I'm going to provide about how adrenal fatigue affects just about all aspects of your physiology, including digestion, immune, reproduction, and of course, thyroid, don't forget to hit subscribe, and have a great day.